Welcome back to the Deep Dive, where we take a stack of information, the dense scientific stuff, and give you the ultimate shortcut to being well-informed. Today, we are diving into a substance that is, well, it's perhaps one of the most famous and certainly one of the most widely used drugs on the entire planet.
It's truly ubiquitous. I mean, if you haven't taken it yourself, you absolutely know someone who has. We're talking about metformin, a drug that's been around for decades. It's the frontline treatment for a massive chronic condition, and yet it's still surrounded by a lot of confusion. How it actually works, where its boundaries lie, and why it seems to pop up for conditions that don't seem related to its main use at all.
Yeah, that's what really grabbed me from the sources. This drug is just everywhere. But the public info on it can be so conflicting, or it's just way too technical. For something so common, that clear, practical understanding just gets lost in the noise.
And that is precisely our mission for you today. We're taking all the trusted, publicly available medical sources, think U.S., European, and global health authorities, and just stripping away the jargon. We want to simplify this into practical knowledge, helping you understand the mechanism and, maybe most importantly, identifying those crucial safety boundaries.
Okay, let's get straight to it then. Forget the dense chemistry. If you had to explain what metformin is and what it does in, plain language, how would you put it?
Great, we can skip the chemistry completely. Fundamentally, metformin is an oral medication, and it's designed to manage blood glucose levels. To use an analogy, think of the sugar in your bloodstream as traffic. And insulin is the key that opens the doors to your cells, letting that sugar in for fuel.
Okay.
In conditions like type 2 diabetes, the cells, they just stop hearing the key. They become resistant.
So your body's producing the key, but the cells are just ignoring the doorbell.
Exactly. Your body's screaming, "Here's the fuel," but the cells are blocking their ears. Metformin doesn't force your body to make more insulin. Instead, it acts like a kind of repair technician. It helps your body's cells become sensitive and responsive to the insulin that's already there. It makes the doorbell work again. And what's just as important is that it tells the liver, which often produces excess glucose overnight, to just slow down a bit. It makes the whole system more efficient.
That distinction is so key. A lot of older diabetes treatments just focused on flooding the system with more insulin. This is a subtle but really powerful difference. It's addressing the resistance problem, not just the supply problem. That's the breakthrough, right?
It is. That shifted approach is exactly why metformin became such a revolutionary frontline tool. It deals with that core metabolic dysfunction.
Okay, let's look at its primary use then. What is it actually for?
Its top priority, the reason for its global fame, is the management of type 2 diabetes mellitus. It's almost always the first oral treatment prescribed when diet and exercise aren't quite enough. And it's important to clarify, type 2 is the form where the body resists the insulin it makes. It's very different from type 1, where the body doesn't produce insulin at all. Metformin is strictly for type 2.
And what about those other uses people might not expect?
This is where it gets really interesting. We also see it used off-label, so for a purpose other than its main approval in managing conditions like polycystic ovary syndrome or PCOS.
Can you give us a quick bit of context on PCOS?
Certainly. PCOS is a common hormonal disorder, and critically, it's strongly associated with insulin resistance, even if the patient isn't diabetic. In those cases, the drug is just leveraging its core strength, reducing that insulin resistance to help with the hormonal and metabolic symptoms of PCOS.
That makes perfect sense. It's treating the underlying cause, not just the symptom. Okay, before we get into logistics, we have to establish a foundational safety rule. Talking about managing drugs often invites the loaded word cure.
And we have to reject that word completely here. While metformin is remarkably effective for managing chronic conditions, it is not a cure. It's a powerful tool that improves metabolic function while you are taking it. It requires sustained use, often alongside lifestyle changes, to maintain any results. So anyone looking for a guaranteed result needs to understand this is about management, not elimination.
Understood. A tool for management, not a magic bullet. Let's get practical. If someone is an adult taking this, what does a typical dose look like? And we have to stress this is for context only.
Right, for context. The typical adult dosing strategy starts low, often around 500 milligrams once or twice a day, and is then gradually increased. This slow ramp-up is really vital for minimizing side effects. Most people end up managing their condition effectively somewhere in the range of 1,000 to 2,000 milligrams per day.
And is there a clear ceiling? A dose that should almost never be exceeded?
Absolutely. The general maximum safe daily limit for most adults is 2,550 milligrams. Going over that significantly increases the risk of serious complications, and you don't really get any added benefit for glucose control. But, and this is a huge but, that dose is highly individual. Things like your age and, crucially, your kidney health dramatically alter what a safe dose is for you.
That heavy variation means medical oversight is non-negotiable. What about duration? Is this a drug people take for a few months, or is it a permanent fixture?
It is overwhelmingly used for ongoing long-term management. For type 2 diabetes, it's often integrated into a patient's daily life for years, often decades. The underlying metabolic issue just requires that consistent support.
If this is something people take long-term, what are those first few weeks actually like? Let's jump into the safety profile and side effects, because that's what often impacts whether people stick with it.
That's a brilliant transition because the side effects are often the biggest hurdle. The most common issues are almost entirely gastrointestinal. We're talking about diarrhea, nausea, stomach upset, maybe some mild bloating.
So the first week is basically, don't make any major plans.
Precisely. It's inconvenient and it can be frustrating. But here's the good news. These side effects are usually temporary. They tend to diminish significantly as your body adjusts, which is why doctors start with that low dose and go up slowly. Most people find that within a few weeks, that discomfort really settles down.
That's great reassurance for anyone just starting out. Now, we do have to talk about the serious but rare risks. We want to keep a calm, fact-based tone here.
We do. The most serious, though thankfully exceptionally rare, complication is called lactic acidosis. This is a severe buildup of lactic acid in the bloodstream. The symptoms are severe: sudden extreme tiredness, profound muscle pain, difficulty breathing, or dizziness.
And why is it so important to know the signs of that, even if it's so rare?
Because if it happens, it is a medical emergency. It requires immediate intervention. We mention it not to scare people, but because recognizing those acute severe symptoms quickly, especially that muscle pain or trouble breathing, is just critical for patient safety.
Now, if someone is on this for the long haul, are there times when they should stop taking it and call their doctor immediately?
Yes, and this is crucial, particularly because of that risk of lactic acidosis. If you develop a severe acute illness, think severe dehydration, persistent vomiting, a high fever, you need to pause the medication and call your doctor. Also, if you're scheduled for any medical procedure that requires iodinated contrast dye, like certain CT scans, the medication usually needs to be stopped 48 hours beforehand, and you only restart once your kidney function is confirmed to be normal again.
That brings us perfectly to drug interactions. This is where it gets really interesting for people already on other medications. Let's tackle the big one first: alcohol.
The caution level is high. Be very careful. While occasional, moderate drinking might be okay for some, heavy or binge drinking significantly increases that risk of lactic acidosis. Alcohol impairs liver function, and when you combine that with metformin's effect, you create a really dangerous synergy. It's a risk you don't want to compound.
And what about common medications, focusing just on the high-impact ones?
The main thing to focus on is anything that affects the kidneys. Since metformin is cleared out by the kidneys, any drugs that impair kidney function can cause metformin to build up to toxic levels. This includes certain diuretics for hypertension and some classes of medication for specific heart conditions. Anytime you start a new prescription, especially for blood pressure or heart health, make sure your doctor knows you are taking metformin.
Excellent context. Let's move to special populations. Are there special considerations for different demographic groups? Let's start with children.
Yes, metformin use in children is generally limited. It's usually only prescribed for adolescents, typically aged 10 and older, who have been diagnosed with type 2 diabetes. And even then, the dosing protocols are very strict, and their response has to be carefully monitored.
And what about the elderly? This is where that kidney function detail becomes critical, right?
It absolutely does. This is the demographic that requires the greatest caution. As we age, our kidney function naturally declines a bit. It's not usually a sign of disease, just part of aging. But since metformin relies on the kidneys for clearance, even a slight decline means the drug stays in the system longer.
So an elderly patient is naturally at a higher risk of accidentally hitting that toxicity level.
Precisely. Because of this increased risk, elderly patients almost always require lower doses than younger adults. And their kidney function has to be checked regularly, much more frequently than for a patient in their 30s. Monitoring is the key defense.
Finally, let's discuss individuals who are pregnant or breastfeeding.
For pregnancy, the decision is very complex. Metformin can sometimes be used to manage gestational diabetes, the type that develops during pregnancy. But that decision is always highly individualized, weighing the risks versus the benefits. Many doctors still prefer insulin for better control.
And breastfeeding.
The clinical data suggests that only small amounts of the drug pass into breast milk, but individuals still must consult their pediatrician and OB/GYN to ensure safety and to monitor the infant closely.
Great. To wrap up, let's make sure our listener can recognize this drug in the real world, no matter where they are.
The generic name is, of course, Metformin, but it's sold under many brand names. For listeners in the USA, you'll probably know it as Glucophage or Glucophage XR. If you're in Europe, it's very commonly seen as CO4 or sometimes also Glucophage. And for our listeners in places like India, a common brand is Glycomet.
So metformin, glucophage, CO4, glycomet, all referring to that same incredibly common metabolic traffic cop.
Yeah.
Okay. So what does this all mean? We've covered its mechanism, dosing, and the crucial safety science.
It means that you are now empowered with clarity. Our synthesis really encourages responsible, informed use. Know why you're taking it, respect the maximum dose, understand that early side effects are usually temporary, and recognize those critical signs that require immediate medical attention. This knowledge lets you be an effective partner with your healthcare provider.
And that leads to our final, essential point. Remember, we've been talking about the big picture, drawing from general medical sources. This deep dive is informational only. It cannot and does not replace the specific advice of a medical professional who knows your complete history. Before making any changes, please consult a qualified healthcare provider.
We sincerely wish you the best of health. And here is a thought for you to mull over as you go. Given that metformin, this old, affordable drug, is now being studied for everything from anti-aging to cancer prevention, how many other foundational medicines already sitting quietly in your pharmacy might prove to be revolutionary tools we just haven't fully unlocked yet? The story of medicine is often about discovering new tricks for old dogs.
Food for thought indeed. That's all the time we have for this deep dive. We'll see you next time.